Hello everyone, Dr. AURORAJ here. We are 48 hours to the exam. Some of you probably will be worried for not having revised all the subjects very well. Some will be worried about the results. Some probably will be getting into anxiety or tensions. Now pack all your emotions in a sack and put it aside. We still have 48 hours. With conscious revisions, we can still be more productive and revise quite a few subjects. Now, let's not get distracted and focus towards every hour with multiple revisions. Let's revise pathology. Cell injury, reversible cell injuries under electron microscope. You can see what loss of microvilli, cytoplasmic blebs and organ swelling. Remember for the exam, mitochondrial organ swelling, which is very important. In light microscope, you can see cellular swelling along with hydropic changes. Now quickly try to look into the images of normal, reversible and irreversible cells. Necrosis is lack of blood supply to the tissues leading it to death. We have caseous necrosis, fat necrosis and also fibrinoid necrosis. Caseous necrosis, remember it is coagulative which is greater than liquefactive. Examples are going to be TB and histoplasma. Please remember TB and histoplasma. Mechanism of action will be high lipid content. It's also a question. Now this is how the image is going to look for caseous necrosis. Yes, fat necrosis is seen in breast due to what? Trauma, and also could be seen in acute pancreatitis. You are going to see what? The chalky white deposits. Question. Good. In fibrinoid necrosis, remember vasculitis and also immune complex. Both are questions. And it is also seen in malignant hypertension. This is how it's going to look in fibrinoid necrosis. Classically seen in also what? Malignant hypertension. Apoptosis is going to be programmed cell death. Apoptosis, programmed cell death. Look at the image here. Now it can be seen physiological and also in pathological condition. Most hallmark feature is going to be nuclear chromatin condensation. Very, very important. Apoptosis, nuclear chromatin condensation. In gel electrophoresis, you are going to look at the normal image. This is going to be what? It is a normal image. If you see a step ladder pattern, please mark it as what? Apoptosis. Yes. And then next you can see necrosis, which is having what? Smear pattern. This is going to be smear patterns. Now the anti-apoptosis, you're going to remember BCL2, BCLX and BCLW. At least remember the initiators of pro-apoptotic, which is being commonly asked. We have BIM, Puma, BID, BIC, BAD and NOXA. Let's revise. BIM, Puma, BID, BIC, BAD and NOXA. Coagulative necrosis are classically seen in solid organs. Remember, coagulative solid organs. We have tombstone appearance, moth-eaten appearance, or also glassy appearance. Ischemia to these solid organs. Very important. It will lead to what? Dry gangrene. It is also seen in Zenker's degeneration. Let's revise. Zenker degeneration and also in thermal injuries. If you ever happen to see this image, it's going to be coagulative necrosis. Good. Now in liquefactive, the word itself is liquefaction. Therefore, it is going to be classically seen in ischemia to the CNS. Yes. Coagulative necrosis along with what? Bacteria. In wet gangrene, we will see dry gangrene along with what? Again, bacteria. Mechanism of action is going to be due to hydrolytic enzyme. This image also been asked in the exam. Please look at the image carefully. This is going to be what? Liquefactive necrosis. Necrosis and apoptosis, very important, know the difference. Necrosis, at least let's remember 4 points. Number 1 is going to be what? It is going to be always pathological. Number 2, it is going to be increase in the size and the plasma membrane is going to be disrupted in necrosis along with a pattern called as what? Smear pattern. Please remember this, very important. Again, for apoptosis, 4 points. It is going to be physiological and also pathological. And the cell size is going to what? Shrunken. Yes. And remember, the plasma membrane is going to be intact and we are going to see step ladder pattern. Yes, step ladder pattern is seen in apoptosis. Dystrophic and metastatic calcifications. Dystrophic calcification actually occurs in dead or dying tissues. You're going to remember the serum level of calcium is going to be normal. Very important. Dystrophic, normal. Whereas in metastatic cancerous. The calcium level is going to be increased. Yes, please remember, it will lead to condition called as hypercalcemia. It is going to be seen in normal tissue. Metastatic calcification seen in normal tissues. What are the example? Let's revise. Dystrophic is going to be atherosclerosis, heart valve disease, and chronic disease. Let's go. Atherosclerosis, heart valve disease, and chronic disease. Metastatic is going to be what? Hyperparathyroidism, cancers, vitamin D3 intoxication, sarcoidosis, and also multiple myeloma. Please also know the examples for dystrophic and also metastatic calcifications. When large number of cancerous cells die at short time, it leads to what? Tumor lysis syndrome, and they release their contents into the bloodstream. It is going to lead to what? Hyperuricemia, hyperkalemia, hyperphosphatemia, and also hypocalcemia. Remember, hypocalcemia. This has been asked in the exam. Now, what happens is in tumor cell lysis, it will lead to hyperkalemia, and this condition can lead to what? Arrhythmia. Yes, and the condition of hyperphosphatemia can cause calcium phosphate imbalance, leading to hypocalcemia. Good. Hypersensitive reactions are going to be type 1, 2, 3, and 4. Let's revise. Type 1 is going to be IgE mediated, seen within 1 hour. Type 1, 1 hour. Type 1, 1 hour. Yes, IgE mediated, seen within 1 hour. Next, type 2 is going to be what? IgG or IgM, cytotoxic. It will see within hours to days. From hours to days is going to be type 2. Type 3 is going to be, remember, type 3, 3 for C, immune complex mediated. Yes, it is going to be seen 1 to 3 weeks. Type 3, immune complex mediated. Type 4 is going to be T cell mediated, seen from days to weeks. Remember, T cell mediated for type 4. Very good. Now, it is also important to revise the examples. Type 4, HS type 4 is going to be having TB, sarcoidosis, and also leprosy. Let's revise. TB, sarcoidosis, and leprosy. TB, sarcoidosis, and leprosy seen in type 4. Type 3 comes to the mnemonic SHARP. SHARP. What is S? S for SLE and also serum thickness. H is for henox-condyline purpura. Henox-condyline purpura. A is for arthritis reaction. Remember, R is for rheumatoid arthritis, and P is for what? Polyarthritis nodosa. Let's go to type 2. Type 2 is going to be what? ABO or RH incompatibility. Very good. ITP will be immune thrombocytopenia purpura and also receptor dysfunctions. Very good. Type 1 is going to be very easy. Mostly starts with letter A. Remember, for asthma, allergy, and anaphylaxis. Asthma, allergy, anaphylaxis, and also add atopy. Urticaria is going to be also type 1 and also hay fever. Remember, Cassoni test, which has been asked in the exam. It is going to be diagnosis of hidradenitis. It is going to be having what? Type 1 hypersensitivity. Macrocytic anemia, please remember, MCV is going to be greater than 100. It comes with the mnemonic FAT RBC MD. FAT RBC MD. This is for macrocytic anemia. Let's go. F is for folate deficiency. A is for alcohol. T for hyperthyroid. R is for reticulocytosis. B is for vitamin B12. C is for cirrhosis. And M is for myelodysplasia. And D for drugs. Yes, it is going to be phenytoin and also hydroxyurea. Remember, microcytic hypochromic anemia will have what? Pale skin and also cold hand and feet. In iron deficiency anemia, remember, which is also microcytic hypochromic anemia, the patient may have what? Depression, hair loss, shortness of breath, and also fatigueness. Yes, he or she may also have what? Frequent headaches and also brittle nails. Good. Along with increased sensitivity to cold as well. Yeah. Thalassemia is very important, and you're going to remember all these few points. Let's go. First point is going to be what? Nest-Roff test. Nest-Roff test is going to be what? Seen in thalassemia. We can see also target cell, oval gel body, Cabot rings, and also basophilic stiplings. Let's go once again. Nest-Roff test. We can see target cell, oval gel body, Cabot ring, and also basophilic stiplings are seen in thalassemia. This is the image of what? Target cell. These are called as what? Target cells. Good. Next, oval gel body is also seen where? In thalassemia, and also basophilic stippling is also seen in thalassemia. Very important. Let's revise. Nest-Roff test, you're going to remember. You're going to remember the target cells, oval jelly bodies, and also basophilic stipplings. Please remember, the patient may also look like this, having a face called as what? Chipmunk face. Good. He or she may be having stunted growth and also splenohepatomegaly. Good. Please revise. Thalassemia. Cell cycles are very important. We have cell cycles are very important. Let's go. G0 is going to be for resting, G1 is going to be for growth, S is for what? Synthesis, G2 is for what? Preparation for mitosis along with growth, and also M is for mitosis. Let's revise once again. Remember, G1 is for growth, S is for what? DNA synthesis, G2 is for growth and preparation of mitosis, M is for mitosis. Remember, S phase, point of number of written content is going to be doubled in synthetic phase, synthesis phase. Next we have G2M, which is going to be called as what? Most radiosensitive phase. Bursger's disease. If you see, blue is discoloration along the proximal part. Remember, blue is discoloration along the tip of the finger. This is called as what? Bursger's disease. It is also called as thromboangiitis obliterans. Thromboangiitis obliterans. Yes. Vasculitis is going to be medium-sized vessel vasculitis. Good. Etiology is going to be due to smoking. PSGN, post-streptococcal glomerulonephritis. Clinical features are going to be child, sore throat. After a few weeks, patient may have edema. He or she is going to have what? Cola colored urine. Cola colored urine is seen post streptococcal glomerulonephritis, and you can see the patient is also having what? Edema. Good. And it is going to be basically a child who is presenting you with sore throat infections, and after a few weeks you will see edema in the body along the face, and he or she is going to have what? Cola colored urine. DiGeorge syndrome, you have already seen it. Remember, catch-22, mnemonic catch-22. C is for what? Cardiac defect. A is for abnormal faces. T is for thymic hypoplasia. We also have cleft palate and also hypoparathyroidism and hypocalcemia. Good. Now it is going to be deletion of 22q11 deletion syndrome. Yes, it is going to be autosomal dominant. Autosomal dominant. DiGeorge syndrome is going to be autosomal dominant. Good. Next, retinoblastoma. We also see this in ophthalmology. Now, patient is going to be present with what? Leukocoria. Yes, it is also called as cat's eye reflex. More importantly, you are going to remember Flexner-Wintersteiner rosettes. Yes, and also RB1 gene mutation, which is seen as 13q14. Remember, retinoblastoma 13q14, DiGeorge syndrome, that is going to be 22q11. Good. Next, SLE, systemic lupus erythematosus. You are going to see what? The malar rash. This malar rash is going to be photosensitive. Very good. It is commonly seen in young ladies, and it is going to be anti-Smith antibody. It is going to have anti-Smith antibody. HELP syndrome. H is for hemolysis. EL is for elevated liver enzyme. And then another LP is for low platelet count. Let's revise HELP syndrome. H for hemolysis. There is going to be destruction of RBC. Yes, the RBC gets broken down. It is called as what? Hemolysis. Elevated liver enzymes. When the liver enzymes gets elevated, it can lead to what? Liver function is going to be compromised. Low platelet count. Actually, the platelets help for clotting. Now, if there is going to be low platelets, it can lead to excessive bleeding. This condition is called as what? HELP syndrome. Good. Now, Klinefelter syndrome. First, you are going to remember it is going to be due to 47XXY. Let's revise. Klinefelter's 47XXY. Let's revise. Klinefelter 47XXY. The patient is going to have what? Lower IQ. He or she is going to be having what? Tall stature. Good. Poor muscle tone, reduced secondary sexual characteristics. At least remember gynecomastia. Gynecomastia, male breast is seen, okay, along with small testes and infertility. Let's revise. Lower IQ, please remember gynecomastia, secondary sexual characteristics reduced, and then you're going to also see small testes or infertility. Klinefelter 47XXY. What is this image here, sir? Please comment your answers. It's going to be Turner syndrome. Very good. Why is it Turner syndrome? Because the patient is having what? Webbed neck. Point number 1 to remember. Second, low posterior hairline. Good. Coarctation of aorta is also seen. Also, streaky ovaries. Please remember, if you see the word and sentence, the question is having streaky ovaries, please mark it as what? Turner syndrome. And also remember cubitus valgus. These are classically the features of what? Turner syndrome. Yes, Turner syndrome. Also remember, it is due to 45XO. Very important question to revise. Occupational diseases sometimes are asked. Let's revise. Silicosis, asbestosis, anthracosis, bichinosis, and bagosis. Silicosis. Remember, man, construction work site. If you see these words, working in construction building, and the X-ray, just X-ray shows what? Snowstorm appearance. Mark it as what? Silicosis. Good. Asbestosis. Inhalation of asbestos fiber. Patient will present you with complaints of breathlessness and mottling is seen in the lung. Anthracosis due to inhalation of coal or smoke dust particles. Good. Bischiosis is going to be inhalation of cotton or jute dust purely due to inadequate ventilated working environment. Question. Next, bagosis, persons working in the cardboard industry for 30 plus years. Bagosis. Good. Sugarcane industry especially. Breast cancer subtypes and its prognosis, very important. First point you're going to remember is going to be HER2. HER2 positive. The patient is going to have what? Breast cancer. Luminal A and B, if you're having ER positive, again the patient can be having what? Prognosis to breast cancer. Or luminal B, it can be either HR2 positive or negative. Good. Now, luminal A, remember, is going to be having the best prognosis. Luminal A is going to have what? Breast prognosis, and you're going to remember HR2 positive. Again, it is going to be confirmation of what? Breast cancer. Good. Parafollicular cells will release what? Secretes calcitonin. Remember, calcitonin are produced by parafollicular cells, and this is the image of what? Parafollicular cells. Good. Now, Burkitt's lymphoma, please remember T18:14, and you're going to see the starry sky appearance. Starry sky appearance seen in Burkitt lymphoma. Papillary cancer of thyroid, remember, you're going to see a very important eye. That eye is called as what? Orphan Annie eye in the thyroid biopsy. Good. Hepatitis B, you're going to see ground glass opacities. Ground glass opacity seen in hepatitis B. Next, in Liebman-Sachs endocarditis, this is the image how it's going to look like. Remember, it is going to be a small, medium-sized vegetation seen in both the sides of the heart valve, most commonly associated with SLE patients. Good. Remember, Liebman-Sachs endocarditis. Multiple myeloma, we have revised this several times. Let's be the last time once again. This is going to be what? Punched out lesions. What is going to be? Punched out lesions are seen in multiple myeloma. It could be a old patient presenting with fever. Yes, he or she is going to have altered globin and albumin. Urinary protein is going to be also present in multiple myeloma. Extra point to be remembered. Next, teratoma. Teratoma is going to have what? All three germ cell layers. Yes, there will be presence of what? Ectoderm, endoderm, and also mesoderm. Teratoma, all three some germ cell layers. Now, ALL, acute lymphoblastic leukemia. Remember, the patient will be presenting with sudden onset of fever with history of pallor and fatigue. Petechial bleeding will be present, and also he or she will be having what? Splenomegaly. Splenomegaly. Good. Chronic myeloid leukemia, remember, with T is to 2022. Normal cells, this is how it looks in leukemia. There is going to be more white blood cells seen. Now, remember, this is called as what? Chronic myeloid leukemia. Look into the image properly. Yes. Let's revise lung cancers. Carcinoma of lungs. Most common overall is going to be adenocarcinoma. Question. Most common in smokers, remember, smokers is going to be squamous cell carcinoma. Lung cancer having worst prognosis, most malignant is going to be what? Small cell carcinoma. You are going to remember adenocarcinoma, squamous cell carcinoma, and also small cell carcinoma. Remember, small cell carcinoma has the worst prognosis and it is most malignant. These are going to be what? Amyloids. It is going to have what? Apple green birefringence. Amyloid stained with Congo red is also a question, and it is going to be seen in polarized microscope. Please remember. Wilson disease, we have also seen it ophthalmology. Just one more final revision. Wilson disease will have what? Kayser-Fleischer rings. Point one to remember. And also it is going to be autosomal recessive. Along with that, we are going to remember chromosome 13. Patient may also be presenting what? Liver cirrhosis. This is due to copper deposition in the Descemet's membrane. B12 and folic acid deficiency will lead to what? Hypersegmented neutrophils. We will see hypersegmentations of the neutrophils. This is going to be due to B12 and folic deficiencies. Good. Myelofibrosis, teardrop sign is seen there. Teardrop signs, look at this. Teardrop appearance are seen on the peripheral smear. If you see, this is going to be myelofibrosis. Very good. Next, Sjogren syndrome is very important. The patient may be presenting with dry eyes, dry mouth, dry vagina. He or she will be having arthralgia, and also remember ANA anti-ROLA antibodies are present. Very important. Yes, in Sjogren syndrome, patient will have dry eyes or itchy eyes, dry mouth, and also vaginal dryness is going to be seen along with skin dryness, and also throat infections. Good. Due to dry throat. Let's revise the condition called as scleroderma. Remember, dysphagia, thickening of oral mucosa, and also leather skin-like skin. Let's go once again. Dysphagia, thickening of oral mucosa, and leathery skin. It comes with a pneumonic crest. Remember, crest. Scleroderma comes with pneumonic crest. Let's revise straight away. C is for calcinosis, A is for Raynaud's phenomenon, E is for esophageal dysfunction, S is for sclerodactyl, and T is for telangiectasia. Once again, crest. C is for calcinosis, R is for Raynaud's phenomenon, E is for esophageal dysfunction, S is for sclerodactyl, and T is for telangiectasia. Cytomegalovirus, very, very important. Again, we are going to see what owl eye appearance. Very good. Now, remember, the patient, this can usually appear after post kidney transplant. Good. Types of grafts, we have autograft, allograft, isograft, and also what xenograft. Let's revise. Autograft, remember, graft from the same person from the other area. It's going to be classically skin graft, hair transplantation, also bone transplantation. Good. Now, allograft, it is between the different members of the same species, namely kidney transplant, heart, lung, and liver transplant. Isograft, I for identical twins. I for identical twins. Good. Xenograft is going to be from different species. Good. Types of amyloid deposits are going to be also very important. Remember, AA, it is going to be secondary amyloids. A beta, at least remember, A beta is going to be seen in Alzheimer's disease, and A beta 2 is going to be seen in hemodialysis, and A cal is going to be medullary carcinoma of thyroid. Good. Lipofuscin. Lipofuscin, you'll be seeing what brownish pigments. If you see brownish pigment, that is going to be lipofuscin along the perinuclear region. Yes, the pigment will be having if the examiner talks about brownish pigment present along the periphery of the cardiac muscle fibers, please mark it as what? Lipofuscin. This is going to be brownish pigment, lipofuscin. Multiple myeloma. Remember, multiple myeloma, we can see Mott cells. These are called as what? Mott cells. Next, we have stellate granuloma, where we are going to see what? Seen in cat scratch disease. Stellate granuloma, also been asked multiple times. Some of my body comes with mnemonic PSM. Yes, PSM square. What is this? Papillary. P is for papillary carcinoma or prolactinoma. S is for somatostatinoma or serous ovarian tumor. M is for mesothelioma or meningioma. Meningioma or mesothelioma. Let's revise once again. If you see some of bodies, remember the mnemonic PSM. P is for papillary carcinoma, prolactinoma. S is for somatostatinoma, serous ovarian tumor, mesothelioma, and meningioma for M. Good. This image over here having what? Brush field spots, clinodactyl, and also having a wide gap between the toes, along with epicanthic folds and slanted palpebral fissures. It is going to be trisomy 21, which is called as Down syndrome. Yes, it is going to be having what? Trisomy in Down syndrome, 21 chromosome. Please remember. Let's revise the LDH isoenzymes in tissues. LDH1 is seen in heart. We have only one heart, LDH1 in the heart. LDH2 is seen in RBC. Good. LDH3 for brain, pancreas, lung, and spleen, along with kidney. LDH4, remember, kidney, pancreas, and placenta. At least remember placenta, if not all. LDH5 is seen in liver and muscles. LDH5, please at least remember liver and muscles. Good. Now, tumor markers are going to be lung cancer. For lung cancer, CA125 or CEA. Liver cancer is going to be AFP. Prostate cancer is going to be what? PSA. And at least remember breast cancer, which is going to have CA125 again, or CEA or HER2 positive. Yes, we've seen that. Or remember also once again ovarian cancer, which will be having again CA125 and the CEA. Remember, ovarian cancers and also breast cancers are going to have mostly same along with HER2 positiveness. Good. Macrophages of different organs. Macrophages of different organs are going to be what? Liver is going to be Kupffer cells. Let's revise. Liver is called as Kupffer cells. For lungs, remember alveolar macrophages. Lung, alveolar macrophages. Skin, remember Langerhans. Skin, Langerhans. Good. Connective tissues, histiocytes. CNS, microglia. Bone is going to be osteoclasts. Bone, osteoclasts. Spleen or bone marrow along with lymph nodes could be what? Reticular or didendritic cells. Please revise this table as well. Rheumatic fever, very, very important. We have major criteria and minor criteria. Major criteria comes to the mnemonic Jones. Minor criteria comes to the mnemonic called as Pal. Let's revise one by one. Let's go. Jones, J for joint movement. O is for only heart. N is for nodules. E is for erythema marginatum. S is for Sydenham chorea. Let's revise once again. Jones, J for joints. O for only heart. N is for nodules or subcutaneous. E is for erythema marginatum and S is for Sydenham chorea. Now, minor criteria. What is it? Pal. C is for CRP increase. A is for arthralgia. F is for fever. And E is for elevated ESR. Pal. P is for prolonged PR interval. A is for anamnesis of rheumatism, and is for leukocytosis. Now, to confirm rheumatic fever, you're going to look at the major criteria or minor criteria. If the patient has two criteria of major, it is going to be also what called as rheumatic fever. Any of these two conditions marked as what? Rheumatic fever. Or any of these one conditions or two minor criteria, any of these two will also be a confirmation of what? Rheumatic fever. Good. Now, G6PD deficiency will lead to oxidative stress in the RBC, leading to these cells called as what? Bite cells. These are called as what? Bite cells. Yes. And these ones over here, these are called as what? Haynes bodies. Let's see why. G6PD deficiency, bite cells and Haynes bodies. G6PD deficiency, bite cells and Haynes bodies. Good. Celiac disease is due to what? Actually DQ2 or DQB. Very important. Please remember, the patient is going to be using only what? Gluten-free diet. He or she is going to avoid rye, oat, barley or wheat. Very good. Rye, oat, barley or wheat. Gold standard diagnosis is going to be small bowel biopsy. Very good. It is called as what? Celiac disease. Remember, the patient is going to also have villous atrophy. Very good. Yes. Now, alveolar types, you're going to remember type 1 and type 2 pneumocytes. Type 1 pneumocytes, at least remember, it is going to be involved in the gas exchange. Very good. Whereas type 2, it is going to be involving in secretion of pulmonary surfactant. Yes. Very important. We have type 1 and type 2. Type 1 is going to be for gas exchange. Type 2 is going to be for secretion of pulmonary surfactant. In type 1 is going to be covering 95% of the alveolar surface, whereas type 2 is going to be 5%. At least please remember this. Good. Next, we have Virchow triad, which is going to be having hypercoagulability, injury and stasis. Remember, hypercoagulability, injury and stasis. Let's revise once again. Virchow triads. Hypercoagulability, injury and stasis. Hypercoagulability, injury and stasis. Yes. Stem cell classification, you're going to remember 3 cell types. That is going to be totipotent, pluripotent, multipotent. Let's go. Totipotent, pluripotent, multipotent. Totipotent is going to be embryonic stem cell. This can differentiate into any cell types. Very good. Pluripotent is going to be embryonic stem cells along with IPCS. It can be differentiating into what? 3 germ layers. Yes, both are important. Granulosa cell tumor. Remember, you're going to see Karl Exner bodies. Very good. I hope the patho revision was quite useful. Now, this is the time for you to touch your own pathology notes right away, or at least today. Try to revise them quickly. I hope this patho revision was helpful. Now, please assure me that you are going to touch your patho notebooks right away, your own handwritten or workbooks. Please go through it for a couple of hours, and whatever you're going to study in your notebooks is going to remain in your memory, and this is going to help you a lot. Wish you guys all the best and keep studying hard. Let's revise more in the upcoming 40 hours. Stay tuned. Thank you. All the best.